The topic in healthcare today is is universal. The United States healthcare system should be more socialized as it is in other countries. We could get help from other countries to make the healthcare system international. Therefore, healthcare advice from international countries such as Europe and Asia should be taken seriously. The central idea of this speech is to analyze how differences in healthcare systems from international countries, primarily in Europe and Asia, can reduce weight gain in the U.S., maintain an accurate social system, and provide proven health results. The relatedness of information found in international countries can be used to help improve the United States healthcare system. Healthcare in the United States is useful in curing patients, but it will not last forever in its realm of knowledge. The U.S. costs have gone up in the system, and it is not universal yet. Countries in Asia and Europe have health systems that rival that of the U.S. Despite U.S. knowledge of medical technology and cancer care, the U.S. health system disadvantages cause a host of problems for our country. Medical research from other countries have also been proven to be successful over time. Changing the U.S. health system will create benefits for Americans. Possible changes studied from Asia and Europe include an increased socialization process, less weight gain, and less medical problems for Americans. By changing the U.S. health system, it will be enhanced to those of international health systems. Problems in healthcare in the U.S. are due to the lack of socialization in the healthcare system and the slow flow of information. The causes for the U.S. health disadvantage are due to the large number of uninsureds, as shown in a publication online, as well as differences in lifestyle, environment, and rates of accidents and violence. The U.S. invests a small share of its economy to social services, including housing assistance, employment programs, disability benefits, and food security. Social services play an important role in shaping health trajectories and mitigating health disparities. The U.S. spending per person was $9,086 as of 2011. Despite U.S. spending on the health system, there have been fewer hospital and physician visits. It is better that there are more insured Americans and seen as the quality and cost of Germany's medical system. Treatment in the U.S. is inequitable, over-specialized, and rejects primary and preventative care. Another country to better their health system is Japan, the first nation to create a comprehensive social insurance program with a universal coverage and excellent health status at a very low cost. In the Netherlands, public insurance is covered through private insurance instead of Medicaid and Medicare, similar to the U.S. The treatment of America's weight problems is one of the health scares that encumbers the U.S. health system. If it's not in the system, then people are not getting help. As cited in U.S. healthcare from a global perspective, 1/3 of adults were obese in 2012, compared to only 15% in New Zealand, the next highest country in the study. A Brazilian research report showed that a daily dose of 2 apples or pears can reduce the severity of spring algae flare-ups by 32%, shut down cravings, tripling your weight loss of dieting. By taking the supplement Garcinia Carbaga 500 milligrams a day can speed weight loss by 25% and prevent rebound weight gain, says Wan Ho, PhD and assistant professor at the University of Nottingham's Malaysian campus. Garcinia Carbaga is a citrus fruit extract that prods the liver to burn fat for energy. Given the health advice from these international countries, weight gain can be reduced naturally without the expense of extra medical technologies. A place where Americans are scarce in resources helping patients for their chronic conditions. The U.S. has the health disadvantage due to the large number of uninsured, as well as differences in lifestyle, environment, and rates of accidents and violence. One of the health disadvantages include the highest rate of tobacco consumption in the 1960s and 70s out of 14 selected countries. In research from the OECD, the U.S. is cited to have the highest rate of mortality from heart disease and amputations as a result of diabetes. The U.S. has the lowest life expectancy at birth of the countries studied, and the highest infant mortality rate. Organization for Economic Cooperation and Development annually tracks and reports on a wide range of health system measures across 34 high-income countries for population health status to healthcare spending and utilization. And as a fact, 68% of U.S. adults aged 65 or older had at least 2 chronic conditions, compared to 33 to 56% in other countries. According to February's issue of Women's World, Asian ginseng can sharpen and focus memory in as little as 30 minutes. The study based on Asian ginseng proved that it can be used to significantly improve symptoms of both dementia and Alzheimer's. From the materials reviewed, it is important to note that the U.S. would be successful if it tapped into the advice of other health systems in Europe, Asia, and other industrialized countries. The OECD forms a union that analyzes these countries that are rich and proudly possess a socialized health system to reduce medical costs. Studies have shown that an enhanced U.S. medical system will not only decrease costs but also make it more socialized, decrease weaken Americans, and diminish the existence of chronic conditions. Specifically, in the countries of Asia and Europe, more socialized methods are being exposed to show Americans how to be healthy without the use of expensive medical technology. This technology can work over time, but is not performing its function and inducing health problems along with competing countries.
Is that it?
Yeah, that's the end.